Hello, and welcome to Counseling Ethics Lecture 10. My name is Dr. Amber Hughes. In this lecture, I want to talk about termination. It may seem strange that we place a strong emphasis on ending counseling, but take a minute to think about your own goodbyes. How have you or how might you handle saying goodbye to someone who means a lot to you? Someone who you have shared deeply personal things with, and someone who knows you better and in a different way than most people do in your life. Remember, much of counseling is about the relationship, so it really makes sense that we spend some time focusing on what it means to end that relationship. Your client may never see you again, and that can be hard for some people. It can be hard for us as counselors. Termination is something that starts early in the counseling process, maybe earlier than you think. Counselors should raise and discuss the issue of termination with the client well in advance of the final session. This varies depending on the length of time you have worked with your client, the age and developmental level of your client, and the depth of your work together. For example, I have one counseling student, I'll call her Sarah, who was working with a 5th grade girl twice a week. This young girl didn't have friends and rarely would speak in class. She had high anxiety and was extremely shy. This girl had gotten to a point where she was talking regularly with Sarah, her counselor, but not many others. Early on during supervision, Sarah and I started discussing termination, knowing that it would be extremely difficult for this young girl. Sarah started termination, I think it was like 5 or 6 weeks before the semester ended, when she would be ending her fieldwork. So she first started talking to the young girl about termination, and then towards the end of the semester, closer to her actual termination, Sarah introduced her to her site supervisor, who was going to be taking over counseling for the girl. And they even conducted a few counseling sessions together, all 3 of them, Sarah, the school counselor, who was her site supervisor, and the girl, to ease the transition process. Now, this is a more extreme example, but I use it to suggest that there is no one-size-fits-all method to termination. Rather, you should anticipate termination as a phase or stage in the counseling relationship that's specific to the client. You should provide pre-termination counseling and recommend other service providers when necessary and appropriate. You might be wondering when you should terminate. Well, Standard A11C says that clients should expect that their counseling sessions will end when they have received what they are seeking from counseling, realize the maximum benefit from services, and when they are not likely to benefit from counseling further. Okay? So ideally, counseling is going to be successful and your client doesn't need you anymore. Then you should terminate. However, you might also terminate if you are realizing that your services aren't benefiting your client. So it may be your type of therapy, it may be the relationship, it may be the client. There's all sorts of reasons why counseling may not work. In which case you might terminate before your client has really changed in the way they are seeking. Okay, so it's really about whether or not they're benefiting from services with you. And for example, I'm thinking of, it was actually I think it was my second cousin. She took her daughter to counseling. Her daughter was young at the time, 10. She had a lot of behavioral problems, a whole lot, at school, at home. And so my cousin took her daughter to counseling. Well, after a couple of sessions, the counselor said that he was going to terminate services with the daughter because the daughter didn't have issues. The issue was with her parents, who were addicts. They were both using at the time, and the counselor said that if the 2 of them weren't willing to come to counseling as a family, then he was going to terminate services with the daughter because she was not going to benefit from counseling by herself. She would only benefit from counseling if they were all in there for family therapy and if her parents were seeking treatment on their own. Okay, so he felt it was his ethical obligation to terminate services because he wasn't going to be able to make progress with that little girl. Okay, and as I said, if you feel like the client is not going to benefit from counseling, you can terminate. Now, there may be other times when counseling ends, though. So for example, during your field work, there's going to be an ending and subsequent terminations when you finish up. Okay, so unless you are getting a job at your site, you're going to need to terminate with your clients, and that's ethical, that's appropriate. There's other times when you may terminate before this natural end. Okay, if you switch jobs, if you work in a school setting, those are endings that come about maybe earlier than you would like. Some individuals may be mandated to see you or may be seeing you in a residential setting. These types of situations may also cause termination earlier than is needed. It may be time limited. For example, if you're working with someone in an addiction center and they are only there for 10 days where they meet with you, and then maybe they transition to someone else to see them for outpatient services. In these instances, you want to make sure you are transitioning your client appropriately and terminating services with you carefully in these cases. Now, those instances I was giving are called premature termination, when we terminate early. When counselors are unable to be of continued assistance to clients or decide to end the relationship over the client's objection, counselors must give adequate notice and give the client time to secure another mental health provider. As I was, some of those examples I was giving, if you are moving, if you're switching jobs, if you're ending up your field work, your clients are not going to like that. And so you want to make sure you allow plenty of time. Think back to that example I gave about my counseling student. She gave her client a lot of time to adjust to her departure from the counseling relationship, from the setting. Sometimes it's the client who terminates the counseling relationship early, and this happens quite often. Sometimes after the first session, sometimes they just stop showing up. So those are instances when termination occurs, but it's on the client's terms, not on yours. Standard A11C gives ethically permissible circumstances for routine and premature terminations, and there's also a list on page 91. Also ethical is if a client is unable to pay the counselor's fee. You can make an appropriate referral in that case to free services or agencies with sliding scale fees. If the client refuses the referral, you are not obligated to provide free services for the client. And finally, we want to consider abandonment. Abandonment it can be considered a form of inappropriate termination and can occur when the client's counseling needs are not adequately addressed by the counselor, either when treatment ends or during the course of treatment due to counselor unavailability. Standard A12 and legal decisions prohibit counselors from abandoning their clients, so you want to avoid it at all costs. Advanced planning can help avoid the risk that clients will feel abandoned by their counselors. So making sure that you start termination early in the relationship is one way to avoid clients feeling abandoned. Another way is if unforeseen circumstances come about. Maybe you're ill, or maybe you have to move unexpectedly, or sometimes life happens, right? In which case, if you have plans in place to help catch those clients, okay, so to transition them to another counselor, have another counselor come in and help with that process. Those are ways that you can avoid abandoning your clients even when circumstances are kind of out of your control. The key to ending a professional relationship with a client properly and not be exposed to charges of abandonment is to give the client adequate notice that the relationship is ending and ample opportunity to locate a new counselor or provide appropriate referrals when possible. And there are guidelines to use when terminating clients in adverse circumstances on page 93. So final thoughts. Avoid abandonment by planning for termination early on, as well as planning for unforeseen or not ideal circumstances such as illness, unexpected moves, and so on.